Thank you and welcome back for those of you who attended the Applying Sensory Processing Techniques to Positively Impact Behavior webinar part 1. We're back for part 2, which we are going to discuss techniques to address sensory processing difficulties. The objective for today's webinar is to present techniques to address sensory processing difficulties with practical activity suggestions provided, discuss how to promote independence, review the research related to sensory processing and sensory-based strategies, and to discuss other points of interest that come up often. So when you are addressing sensory processing difficulties, there are several ways to address these difficulties. There are sensory diets, which are addressing the actual deficit. There is adapting the environment which compensates for the deficits, and structuring routines, which provides the predictability. So, sensory diets, what are they? They are based on the principle that individuals require a certain quality and quantity of sensory experiences to be skillful, adaptive, and organized in their daily lives. So this was modeled after the idea of a nutritional diet. So when you think about your eating patterns, many times people will tell you in the morning you want to start out with something with some protein that's going to give you some more energy, and you have protein during your main meals, but then you also have some snacks along the way to keep you satisfied throughout the day. A sensory diet is very similar. So there are certain activities that are going to be more impactful, and then there are going to be other activities that you can do that you can sprinkle throughout your day to help keep your attention and your arousal level optimal for learning. The goals of sensory diet are really, number one, to promote optimal level of arousal, self-regulation, and behavioral organization. So you're helping a child maintain that optimal level of arousal. You're promoting adaptive and skillful behavior, and you want to ultimately reduce sensory dysfunction. So skills develop as you practice and as areas of the brain mature. So sensory diets really provide the brain exposure and practice that create and strengthen those pathways in the brain. So when an individual is seeking out certain sensory experiences, providing experiences in a controlled, functional manner allows the brain to develop more typical processing. It also teaches the individual strategies that they can use to obtain those sensory experiences in a more functional, typical way. When individuals are averse or they're avoiding certain activities or sensory experiences, they can develop a more typical sensory processing through exposure. So in this case, you present that aversive experience very slowly in a very controlled, safe manner so that the child is able to build up their tolerance to the activity. You'll have students that will have occupational therapy treatment in the area to address sensory processing. They are basically, the occupational therapist working with that student is going to provide these experiences in that controlled manner that's going to help almost like strengthen certain connections in the brain, that's going to help develop more positive activities, more positive reactions. And then they're also going to provide activities, if there's that aversion, that will build up that tolerance and that ability to participate in activities that may be aversive. The sensory diets are something that should be throughout the day. So a child may go to occupational therapy once, twice, maybe 3 times a week. That would be a lot of therapy. But they're only getting that therapy once or twice throughout the week. Whereas parents, teachers, individuals who are with that child throughout their life are able to really support the therapy by using these sensory diets. Sensory diets are something that can be used without the child being in occupational therapy services as well. It's something that is used to support learning. So when you're planning a sensory diet, you really want to think about how sensory activities have different meaning for different people. So oftentimes when I lecture, I'll bring a bunch of different sensory experiences and I'll send them around and let people try them. So I'll bring out this spiky blue ball that made an appearance in part 1. Oftentimes I'll send this around, and when I ask for people's interpretation, I'll say, who enjoyed this ball? I'll have some people, maybe half of the people, a third of the people raise their hand. And then I'll say, okay, who didn't like this ball? And then I'll have half or a third of the people raise their hand. So this is a very subjective piece of equipment, and there are generally some activities that you can do that are more alerting, and generally some activities that are more calming, but you have to try things out in order to know how it's going to work with that individual you're using it with. So thinking about when you're planning a sensory diet, maybe putting out a bunch of sensory experiences and seeing what has the most benefit for that student, what seems to be obtaining the right kind of outcome. So if you're working with somebody who requires calming activities, when you are trialing out activities, you want to see things that are going to bring their activity level down. On the other side, if you're working with somebody who is low arousal, that needs more waking up, more stimulation, you're providing these activities and seeing how they respond, and you want activities that are going to have them open up their eyes, have them have more movement, have more visual attention, have more auditory attention to the activities that you're presenting. Activities should be incorporated into daily life. So when you are having these sensory diets, you're using them and you're integrating them throughout the schedule of the day. You want to plan very carefully around times that are difficult. So ideally, if you know that there's a certain time of day that tends to be more difficult for someone, you would like to add a sensory activity that you know would have a positive outcome right before that time of day. So for example, if you know that bath time at the end of the day is always a challenge, you might have the sensory activities throughout their day, and we're going to talk about specifics of these activities in a little bit. But you have these activities throughout the day, but maybe you add an extra one in right maybe like 15-20 minutes before it's time for bath time. And that's really going to help organize that child's system, so it's going to prepare them to handle that difficult time.